everyone. Come on in. It is All Things Odd. It's Thursday, 12:30. And so I'm Dr. Phillips.
And I'm Dr. Galloway.
And I'm Whitney.
And we are going to start off by talking about our YouTube channel.
So we have some really exciting news. We have more subscribers than we have ever had. So we have 72 now. We got 3 since the last time we talked about it, which is funny. And we also had some new viewers last time that were, asking questions and stuff during the show. So that's neat. But you can come to our YouTube channel and then you can subscribe and then you'll get notifications about new videos when we post them. And you can kind of see the videos better here as far as like what they're about, and the thumbnail images are fun. And so you can find some different topics that you want to learn about.
Awesome. So thanks for following, you guys. Okay, let me get back to my screen here. Okay, so today I'm going to have Whitney introduce the show.
Yeah, so as you guys probably know, it is February, and I actually can't believe February is almost coming to an end, but February is Heart Health Month, so very fitting with it being Valentine's Day season. But February is American Heart Health Month, which is a national awareness campaign focused on promoting heart health and preventing heart disease. So we have some recommendations from the National Institute of Health. So a couple ways that you can, improve your heart health, because heart disease is the leading cause of death in the United States, but it can often be prevented. So getting better sleep is one. So trying to get to bed earlier so that you can get that good 8 hours of sleep. Eat healthier whole foods is another way to improve your heart health, trying to stay away from maybe some of those more processed items, which will help you maintain a healthy weight, which is another recommendation, as well as just to be more active. And then, of course, just to stop smoking. NIH actually has a very cool printout. It's 25 ways you can take part in American Heart Health Month. And I'm just going to share, they have a lot of good ideas on here. Some of them are a little bit more like arbitrary, like you can wear red on Fridays in February. But a lot of them are actually getting other people involved, which are the ones I want to talk about. So one of the recommendations to just promote heart health is to commit to a walking schedule with a family friend or a family member. I know Dr. Phillips is actually walking for her own reasons right now, but it's just a really good thing to do. You can even challenge your organization. So like we could actually all try to calculate each other's steps to see, if we're all, how many steps that we're all getting. So just being active is a really good way to improve your heart health. Another one is trying a new recipe. So you can actually ask your friends and family if they're interested in sharing their favorite heart healthy recipes. And then this document, which I don't know if Dr. Phillips has the link for this, but you can actually find heart healthy recipes on this on this website. So if you are interested in maybe having some more ideas, maybe it's been, a New Year's resolution that you want to eat a little bit better to help improve your heart health, that this is a good resource for that. You can also attend a cooking class, which if you're local to Fort Collins, I know that there's actually a few places in town where you can go and attend a cooking class to learn some new meals. Our practice has actually done that, and it was a really good time. And then, other things that you can do is if you want to, if you're feeling up to it, maybe heart health is very near and dear to your heart. You can actually host an online or a community event where you're raising awareness of heart health. So that just gets families and friends involved in the cause. And you can also invite like local hospital resources to come help educate on heart health. So those are just a few of the 25 ideas that the National Heart and Lung and Blood Institute came up with on how you can spread awareness for heart health.
Thank you. Okay, so I did post the clickable link. So this obviously isn't going to be clickable, but when you go into the comments in Facebook or on YouTube, there is that clickable link for that handout that Whitney had just covered. So just wanted to show you guys that in the comments. Yeah, I think it's kind of cool. Just I am in National Charity League with my daughter, and it is something that mothers and daughters do together, learn about community and leadership and philanthropy. And we just had a meeting earlier this month, and it was kind of cool because we had someone come out from a local hospital that had talked about just heart disease and just kind of quizzed us a little bit about what we knew, and then had like this travel CPR so we could kind of practice doing CPR, and putting these pads on. I forget what it was called, but it was like literally to revive them. That's part of CPR now, actually. So you
Oh, an
don't.
AED device.
The
Yeah.
defibrillator.
Yes,
Yeah.
yeah, that's what it was. Sorry, defibrillator. And so, and then we had like a bicycle that you could bike, and it created a smoothie for you. And I thought it was kind of funny because my son actually has that in his dorm, is that you can go ride this bike and it makes smoothies for you. And so it's kind of interesting, but
cool.
just, yeah, lots of different like awareness.
Whatever to motivate you.
Right. So I think it's kind of cool. But yes, click that link. There's some 25 great ways to at least help spread awareness. There's still, a good week and a half, I guess, ish of February to participate, or you can do it and it doesn't have to be February either. But we're just talking about healthy hearts because we also want to relate it to the ears as well. So I'm going to let Dr. Galloway talk about that.
Yes. So you might have wondered why we're talking so much about hearts and what that has to do with your hearing. But blood supply is a big deal. And if you don't have good blood supply to your ears, you don't hear well. And so this information that I have is from betterhearing.org. But in 2012, Dr. Charles Bishop proposed that the ear is a window to the heart. And so there's connection between your hearing health and your heart health. And it's thought that maybe sometimes change in hearing could be sort of a tip off to or having some cardiovascular issues. So if we don't have adequate circulation of our blood, that's something that can show up, and then we can, diagnose hearing loss that may be associated with that. I didn't know that heart disease was the leading cause for both men and women in the United States. But there's different types of heart disease. So there is coronary heart disease, arrhythmia, heart valve disease, or heart failure. So all of these are going to affect the way that your heart pumps blood to the rest of your body. And if it's not getting all the way to the ear, then we might have, some symptoms, ear-related symptoms. There are some other symptoms too that warn us of the onset of heart problems. And, these are ones that you've probably heard of: chest pain, shortness of breath, racing or slow heartbeat, fatigue, dizziness or fainting. Things like that are symptoms that, could indicate that there's a heart issue. So those would maybe require talking to someone's doctor or trying to figure out, there's different like stress echo tests and things they can do. But the ears may be the first indicator that a heart problem is occurring. So Dr. David R. Friedland, he is a professor and vice chair of otolaryngology and communication sciences at Medical College of Wisconsin, noted that the inner ear is so sensitive to blood flow that it is possible that abnormalities in the cardiovascular system could be noted here earlier than in less sensitive parts of the body. Do you guys remember learning that there's actually like a physical landmark on one's ear that may indicate like need for cardiovascular workup? It's like a wrinkle that's close to your earlobe. And my friend that works at the VA is the one that told me about it. And I looked it up, and it's like a real thing. Did you guys know that?
I don't think I did. I don't know.
I'll find something on it, and so that we can share it out. But essentially there's like a physical marker that obviously it doesn't mean that because you have this wrinkle on your face that you 100% have heart disease, but it can be an indicator along with some other things. And so I thought that was interesting to know about.
Yeah. Okay, which kind of leads us into what I was going to share, which is that physical marker is also called
Oh,
Frank's sign.
Oh.
So doing research, I thought
that's
it was
hilarious
super
because you didn't even prompt me. I just did
no. And I was
that.
like, I bet you, and I didn't tell them actually what this was about because I thought, oh, this is kind of interesting. So number one, I did not learn about it. Unless I did, I forgot. Number two, I was sitting here thinking, I bet you Dr. Galloway has heard about it because she has this brain that like filters stuff and
Weird.
files it away somewhere and then is able to pull it out. So I'm sitting here going, I bet you she actually heard about this, which is kind of interesting. And so I thought it'd be interesting to kind of share this. And I wanted to pull up an article about it. And this is from Stanford Medicine. Let me get to the share screen. And so Frank's sign is really kind of interesting. And I have a picture. That's why I wanted to pull that up so that you guys could kind of actually see that. And it's this little it's this little wrinkle, like you said, that you can kind of see here. And, it's basically what they're finding out is that it's a diagonal crease in the earlobe that extends from the tragus to the edge of the ear. And it's named after Sanders T. Frank, which is an American cardiologist who first described it in 1978. And it's been associated with increased risk of cardiovascular disease, such as coronary artery disease and stroke. And studies have shown that people that actually have Frank's sign are more likely to have atherosclerosis, which is the hardening of the arteries, a myocardial infarction, which is like a heart attack, or peripheral vascular disease, which is a blockage or of blood vessels in the legs. Now, I do have to say though, because looking at this, I don't want people to like freak out if you have this little wrinkle, but it's not a definitive diagnosis of cardiovascular disease, but it's a potential indicator that may warrant further medical evaluation to assess for cardiovascular risk. So hopefully, like we're going to put that out there, but also I was trying to decide whether we should talk about it or not, because I don't want people to go, oh, you have this wrinkle on your earlobe and oh my gosh, and I think what's interesting about this article here, and I'll kind of scan through this because you can kind of see another picture right here, which is a little bit closer, right? Same patient, more obvious example here on the other ear. And then there's a lot of different information here about this. But on the bottom, I was going to scan all the way down to the bottom of this article. They found it on Steven Spielberg. So it's interesting.
Did they tell him?
I don't know. At the bottom, where did it say here? Here. It says, do you know of any famous individuals with this sign? And it says Roman emperor. There are sculptures that show it right here. And then also Steven Spielberg. And it just says, let's hope they have gone to see their cardiologist recently. So I don't know. I thought it was kind of interesting to kind of bring it up. And this one, I like this picture better because I think it's a little more prominent here. Prevalence of Frank's sign, it just kind of varies on the population, but it's estimated to be in about 10 to 20% of adults. And factors that may increase the risk of developing Frank's sign are age, male, gender, diabetes, high blood pressure, high cholesterol. And again, it doesn't necessarily mean that you require treatment, but you're more at risk. And I think in this article, when I was reading it, I don't know if it was this article or not, there wasn't a big, here it is. Yes. So there wasn't a big study at the time when he found it. It says here that it's 20 patients, right? And so he observed this crease in 20 patients. So, again, it's one of those things where we like to bring stuff up like that, and we like to just kind of make sure that it's out there. And again, this is just spreading awareness. It doesn't mean that you are will have cardiovascular disease, but it definitely is a sign to get checked out, and you might be more at risk. So it's interesting that in Dr. Galloway's schooling that she remembers, or her friend remembers that. Whitney, I don't know if you recall that. I had no clue. So I apologize to professors. Maybe you did cover it and I just don't remember it, but I did not know about this at all.
Well, and I will say that my friend that works at the VA, her typical patient is an elderly male service member. And so, she's kind of seen more of that specific population. And then also with the VA, they can have care, but you might have to be referred to cardiology or something. And I have no idea if that's something that she actually does, but I could think of just being a family member. There's been tons of heart issues in my family, and something like this, especially maybe to somebody that's a little bit resistant to go to the doctor or is not the first person to sign up for a physical, if you saw that sign on their ear, you could let them know that is, an increase that can be associated with an increased risk of, this, and maybe something like that would be enough to get them to go visit a cardiologist or talk to their primary care doctor about concerns. Because it's like, you can't make that up. A lot of people don't have that. And if you're not born with it, it just comes over time. So really interesting.
Yeah, I think it's kind of interesting. I liked when I first read about it, I'm glad there was a picture because I was kind of imagining it a little bit to see what it looked like. But again, if you're an audiologist, and we share this in our audiologist groups that we have, start looking for that as well, because we can be like an entry point for people to at least get them to get something checked out, right? We're not saying that it's a definite diagnosis, but at least it puts you a little bit more at risk and you should probably get checked out. So thought we would add that in this awareness show for Heart Healthy Month. And hopefully, if you guys are celebrating or, trying to spread awareness as well, share what you're doing and get other people on board with whatever you're doing to spread awareness of trying to keep healthy in American Heart Month. So
I actually have one more thing because we always talk about the Lancet study. So when they did that study, it says that if you're in the middle of your life, or, like a lot of our patients, the 3 most modifiable factors to ward against dementia are your hearing, your vision, and your heart health. So I thought that was kind of fitting. And I tell patients that because it's short enough that I can remember it. And it's like your eyes and ears and your heart are the most important. Once you're already, part of the way through your life, you can't change your genetics. You can't change if you smoked 20 years ago. You can't change a lot of things, but you can go get your eyes checked and get your ears checked and make sure that your glasses and your hearing aids are tuned up and go get your heart checked. So it's another
good advice. Good
motivating information.
Yeah, awesome. All right. Well, with that, we will be back next week to close off the month of February, and we will see you then. So tune in then. Thanks, guys.
Thanks.